All right, hello everyone. Grateful for for your time today, and grateful that you're able to attend our webinar today. We're going to be talking about Social Security and Medicare, and we have a great panel set up for you today. As you guys know, both Social Security and Medicare are extremely important benefits when it comes to your retirement, and they can be paying out benefits to you over the next 25 to 30 years. So it's important that you are educated in regards to what plan makes the most sense for you. We hope today that you'll get a little bit more insight in that regard. And by the end of it, we hope you have a little bit better understanding of what these important benefits can do for you. As we go through this, we want to answer some questions at the very end, but as you get questions, there's a chat function. Just go ahead and add any questions you have in the chat function, and then at the end, we'll go ahead and answer those. We're going to go through probably about 45, 50 minutes of content, and then we're going to have some time towards the end to answer those questions. So we're going to start off with Eli Christensen. He's a wealth advisor here with our firm, Presidio Wealth Management, and he's been in the industry for about 17 years, coming over from Morgan Stanley, and he's been helping people prepare for retirement and retire over that duration, and we're sure glad to have him here. And after he wraps up, Aaron Kornberg, he's one of the founding partners of the Altus Group, and he's a Medicare specialist. He's been helping hundreds of people go through these very, very important benefits. So I'll turn the time over to Eli.
All right. Thanks, Parker. Appreciate it. And good afternoon. Yeah, so like Parker said, I'll be going through Social Security. We'll talk through a lot of the rules that surround it, maybe ways in which we can avoid potential pitfalls, a few strategies, because I think overall, people come in with kind of the idea that when I retire, I get done with my work, I'm going to claim Social Security, I've paid into it, now I get it. But as you'll see by the end of this, you'll see there's a lot more nuances to it than that. And there's ways in which either A, if we don't understand it, we could be missing out on some potential benefits. So we don't want to miss out on those. And there's actually some opportunities that go along with it. And it's not just understanding the plan itself, but understanding everything that could potentially affect it. So I'll share my screen here. So first off, I think the first thing we have to recognize, and this is one of those outside effects, is that people are living longer, right? As we get better at healthcare, we're finding some potential benefits, drugs and so forth that allow us to live longer, happier, healthier lives. We're seeing that trend continue, and honestly, with AI coming around, and getting integrated to some of these healthcare industries, we're going to see this number continue to progress northward. We already have, with the amount of data we're able to collect over these last 20 years, people being able to be better connected, share insights, being able to find ways in which to expand that longevity. So a couple of eye-popping numbers, some that when I first looked at this, I wasn't aware of. Couples, if you're married, 50% chance that one of you is going to be living to age 92, and a 25% chance that one of you will live to 96. So if you're married, one of you most likely will be living into your 90s. And if you don't have a spouse or a significant other, still those numbers are climbing, and they're pretty high. And I would even say it's not even so much some other numbers I've seen when it comes to integrating, the longevity of life. It's really about relationships. So those that are able to maintain positive relationships, whether with a spouse, significant other, or friends and family, and those who have more connection and relationships tend to live longer lives. So I think this is something really to be mindful of, because as you'll see in this next slide, 2/3 of people are taking their Social Security early. So statistically speaking, that shouldn't be the case, right? more often than not, we should be looking at taking it later, just from a pure math perspective. But that's not the case, because typically when people get to retirement, they kind of have that mindset of, I'm retired, I'm going to start collecting on this. They also think, well, I've been paying on this, I want to get my money before I die. You know, how do I collect that? I want to get my money's worth out of it, you know, paying into it from the government. Or maybe and then you have that cascading group effect, right? That's what my neighbor did. Maybe that's what I should do, and so forth. So it's really good to understand your own personal situation and how that plays in. Just because overall we're seeing the math isn't lining up on how long we should really be waiting to cover for that Social Security. Rules of retirement benefits. So I'll go through some individual benefits, but I wanted to upfront make you guys all aware of how you can see this ahead of time. So maybe you're still, 5 years out from retirement. And when you think you may be taking Social Security. However, you can go to ssa.gov and run an analysis for yourself specific to you. So I'd highly encourage all of you to do that. And I'll reiterate this at the end. But this is essentially what it looks like. It will go through all of your benefits, the dollar amounts, and so forth, so you can get a good detailed estimate. It's still a bit of an estimate because we also have to factor in, depending on how long you have to wait. There's cost of living adjustments that they make to it, especially over these last couple of years with the rate of inflation. So some things to consider there. But a great starting point would be to get your report done for you individually. Okay, so the trade-off for individual benefits. So we're just talking about if it's you and you alone, there's obviously reduced benefits. So your first age of retirement is 62. And if you take it early, before your full age of retirement, you're going to have a reduced benefit, and we'll go through those numbers as well. A term to remember is this PIA, primary insurance amount. That relates to basically the dollar amount that is assigned at full retirement age. And this will get brought up several times throughout these slides. So it's good to kind of have that in mind, and we'll touch upon it. It's a very important number and kind of where everything is based off of. And then, of course, if you do wait until after your full retirement age, you'll be able to have some increased benefits. Now, this shouldn't matter too much, but it's on the slide, so I'll cover it real briefly. If you were born 1954 or earlier, your retirement age, your full retirement age will be slightly lower. Now, if you do the math, 1954, it's 2024, that's 70 years. If you haven't retired yet, your age of retirement is going to be 67. But something to keep in mind, they have been moving that number back. And I think that's kind of the important thing to note here. Depending on how much longer you have, that number has been moving back. A lot of it to do with that previous slide that I showed. People are living longer, which means the government's got to pay out more and more money to these people for longer periods of time. So that number keeps sliding backwards. So this is the collection benefit. So if you end up deciding to collect early, these are the reduced percentages. So you can see at age 62, you'll only receive 70% of your benefit, all the way up until, if you take it a year early, you will receive 93%. So that's the cost of collecting early. Now, of course, you're receiving the benefit earlier, so there is a break-even point, and we'll go through that briefly here in a few slides. So what to consider on whether you should take early or late. We will look at each one of these, but are you working? Are you planning to continue to work? What does your work history look like? What's your family history like? How long do you feel like, how's your health? How long do you feel like you might live? And then also, are you married? And what is the health of your spouse? A lot of those factors play into it. And I would even add to this slide, A big component is what have you done outside of Social Security to save and prepare for retirement? That also factors in greatly on really when you should be taking Social Security and what strategies you should use for that. So the first one, working. The big thing to note here is if you want to start taking Social Security early, so this is before your full age of retirement. If you're making over $22,320 a year, you will receive a reduction of benefit. Now, the idea behind this is the government wanted Social Security to be a supplement to retirement, not just an added payout. So if you plan to work and collect Social Security prior to your full age of retirement of 67, there will be a reduction of benefits. So you can already see there are some potential strategies and items and potential pitfalls to consider. But once you've hit the age of retirement and you've got that full 100% of PIA, you can work as much as you want, continue to do that consulting work. I think this is where it plays in most. A lot of our clients, have developed a good, background in education in the field of study that they were in and their work. And then they continue to maybe do some consulting work on the side or continue to generate income. And so you have to be mindful of that when you go to retire. Now, let's say you started and you're like, uh-oh, the consulting work's making more money than I thought. There is the ability to withdraw your application. Now, you do have to pay whatever you received back, and it has to be within the first 12 months of claiming your benefits. So if after the third month you realize, man, I want to do some consulting work and I'm making a few extra dollars, I'm going to be making over that 22,000. Maybe I should withdraw this application and get it restarted. Again, you can do that, just needs to be done within the first 12 months and pay back the amounts that you received. So we talked about if you take it early, now what if you take it later, right? And you decide to wait. At full retirement age, that's at 100% of your benefit amount. And each subsequent year, it continues to increase. And if you do the math, it's 8% per year. So at age 70, you can receive 124% of your full benefit amount. Like I had mentioned before, there is a cost of living adjustment that goes along with this. And we saw these two big spikes here. That's because of the amount of inflation that we've had. And we also had another decent sized one above average this last year at 3.2%. So the government does take that into consideration. New money, a lot of more dollars in the system. We do need additional benefits to take care of our seniors and those in retirement. Question of longevity. So I'll kind of click through three of these and really what you need to know, like I had mentioned before, sometimes taking it early makes sense, but there is that break-even point, right? So if you take it at 62 versus that break-even point of 67, or if you wait to take it at age 70, there is still going to be a break-even point, right? Because you decided not to take it for 3 years. So you're missing out on those benefits for 3, but then you're getting that higher 124% of benefit later on. So there are those break points. And I think the thing to note is that basically, if you're going to be feel like you're going to live past the age of 82 and a half, waiting oftentimes is one of the better solutions. Spousal and survivor benefits. This is where it starts to get a little bit more complicated. So the two individuals we'll cover named Jordan and Alex, gender neutral name. So whoever the breadwinner is, that's who Jordan is. So Jordan, his total PIA is $2,200. So that's the amount that he would receive at age 67, his full retirement age. Alex would receive, if Alex received no benefits, meaning Alex didn't work throughout the duration of their marriage and their career, and they decide, yeah, we're going to need that extra income, and they're married, they will receive 50% of that $2,200 of that PIA. So when we look at it, Jordan starts collecting at age 67, receives the 2,200. Alex then starts to also receive their 50% of $1,100. So giving them a total of $3,300 per month. Now, what if Jordan decides to collect early and gets that reduced benefit, that 70%, which is $1,540? Alex can also, at full retirement age, decides, you know what, I want to start collecting on this benefit, can receive the full $1,100. Because again, it's 50% of the 2,200. So full retirement age, 100%. Spouses do have the same reduction, and we'll go through some of this as well. So if Alex and Jordan decide to collect early, Jordan will receive the 70% reduction, and Alex will receive a 65. Will have the 65% of the 1,100. But then once you've reached that age, that full retirement age, or once Jordan has received that, reached that full retirement age, they will receive 100% of the benefit, regardless of if you wait, right? So 100%, no matter what, it can't move past that 50% threshold. So we'll show the illustration here. Jordan waits, starts collecting $2,728 at age 70. Alex receives the 1,100. Now, we have another aspect to this. If you decide to suspend, again, like I said, it starts to get a little nuanced, and depending on your situation, there's some different strategies. But essentially, if they both start collecting early, receiving the lesser amount, then decide, you know what, maybe we didn't need that much, or we didn't need it that early, let's suspend this, right? So he goes on a suspension. He starts receiving 8% annual increase on that benefit amount during those 3 years. Alex doesn't receive any at all, but then they pick it back up, and they're able to receive a higher benefit from then on out. So that is an option and a potential strategy depending on where you're at as you get into the middle of it. Now, let's say Alex did work a bit, and Alex's PIA is $600. So a smaller amount and still less than 50% of Jordan. The government doesn't give the 600 plus the 50% of spousal benefits. So you can see here, and I'll just focus on this one because again, we see the reduction on the back end or the increase if we wait. But overall, as you see, the government's only going to make up the difference between what Alex is receiving and that 50% threshold. So still, again, the max is the 1,100. So now what if they both have significant, right? Both of them are above 50% of each. Then it just moves to the individual collection method, right? So if they both wait until full age of retirement, they receive the 2,200 and 2,500 respectively. Makes it a little bit more straightforward. We can see that oftentimes, and I think what's important with this slide here is that depending on if you have a surviving spouse, so the breadwinner passes away, depending on when you start to take that benefit is going to be based upon that breadwinner's future age, right? So as you can see here, Jordan's benefit at age 64 and 6 months is $1,833. Alex will get the $1,833, and same if waiting until age 70. So it's not, immediate. You do have to base it upon the spouse that has passed. Collection strategies. The thing to note here, and I'll go through these quite briefly, but you can see that there's a lot of different strategies depending on if you're married, both collecting at age 62. What does that equate to in terms of dollar amounts and total benefit? There's also adjustments. There's married couple collecting at age 67. These are all just examples, and we can go through this individually if you want to come in and work through some of these strategies. But you can see that as we start to move along, there's a lot of potential options and strategies on how you can work this in. The next, and I think the last thing I'll cover here is beneficiaries and surviving spouses. So we have the kind of the straightforward surviving spouse situation, but what if you were married for 10 plus years? You are still entitled to a benefit. So you can see here spousal benefits. If you're married to your ex-spouse for 10 plus years, you're currently unmarried, both were age 62 and divorced for at least 2 years, you can start to receive that spousal benefit. You can receive a survivor benefit, married for 10 plus years, unmarried, and at least age 60, then you can start to receive benefits there as well. So not all is lost. I was actually talking to Parker right before this, kind of working through some of the nuances. You know, if you end up getting divorced right before you get married, there's, you know, it's not like you're just going to be out, and too bad. The government understands that and makes for a benefit there. So lastly, and this is what I talked about before, is understanding all the nuances, the outside effects that go into your decision around Social Security. Your potential for taxes, potential of paying taxes on your Social Security, depending on your income amounts, is really important, right? The other factor that plays into it are the accounts and investments that you've made prior to and leading into retirement. When you're going to start using those, are those accounts taxable? Are they retirement accounts? And so forth. And a lot of it goes in. I can tell you, you know, the majority of the plans we put together, oftentimes we're calculating all of this in to make sure we can bridge that gap in the most effective way, so that over the short term you're taken care of, but you're also maximizing the amount of benefits you're going to be receiving throughout your life and potentially your spouse's life. So next steps, like I had mentioned before, SSA.gov is a great place to start. Download that report, start to get an idea of what your potential benefits are, start to kind of compare and contrast to what you have outside of Social Security for retirement when you're thinking about retiring, and what you will actually be doing in retirement. So, because like I said, sometimes consultant work, hobbies can turn into real income, and that does play a factor and something that you need to calculate in. So the step after that is, once you've gathered that data, you can give us a call. We can walk you through this. We help clients with this pretty much on a daily basis, especially for all those clients that we have who are, you know, 10, 5, 2 years out from retirement. Those that are in retirement, we're constantly working through those plans. So it can sound like a lot of nuances and a lot of things to consider. But we've done it a lot, so we can certainly help you out with that. And that's all that I got, and I will kick it over to Aaron.
Eli, it looks like you have 3 questions in the chat.
Sure.
Do we want to save that for the very end, or do you want to? Parker, you're still muted.
Yeah, mute. Sure.
Yeah, thanks, Aaron. Yeah, we'll knock those out, and then we'll move on to the Medicare portion. So we have 3 questions right now. The first one is, and I've got a slide on this, Eli, if we need to address it. But so to clarify, if you reach full retirement age and want to work, what is the dollar salary amount limit you can make working? Is that the 22,000?
Nope. So I'll move back to that slide real quick. Get there.
I've got right here too, Eli.
There we go. All right. So once you've hit full retirement age, beyond, I should clarify, beyond full retirement age, you can make whatever income. Now, that doesn't necessarily mean you won't be taxed on your Social Security. This slide shows that you will receive a reduction of benefit if you're taking it prior to. So so it can get confusing on that there, but there is two different aspects, right? So if you take your Social Security while you're still working and you're not quite at full retirement age yet, you will receive a reduction in benefit, right? Once you've passed full retirement age, and I should say past full retirement age, because you can see this 59,520 mark here at full retirement age. So within that year of full retirement age, that's 59,520. You will receive a reduction in benefit there. But once you've passed that age, then you can make whatever income and you won't receive a reduction of benefit. Now, however, no matter what age you take your Social Security reduction of benefit or not, you could have potential tax consequences, or I should say, you might have to pay some taxes on that amount, depending on how much money you're making.
Great, thanks. All right, we've got two more. So are the divorce benefits one or the other? So your benefit choice. So can you choose your own or theirs, whichever is greater, or is it one or none?
So say that again.
So are the divorce benefits one or the other? So like the spouse's benefit or their own, whichever is greater?
Yeah, so I mean, you're essentially going to take the greater amount, right? If you both had a PIA, right, and yours was higher, then yeah, you'd want to take yours for sure.
Okay, great. And then we've got one last one. Do the taxations change over the years, or are they set for the whole duration? I think they're talking about the income amount and how much you're taxed.
Yeah, so that was right there towards the end. So it's throughout the duration, but it depends on, it's solely based upon, so kind of like what I was saying before, right? There's two aspects. If you take it early and you're working, reduction of benefits, but the taxes don't go away. So regardless of when you're taking them, you can be taxed on your benefit amount depending on how much you're making. And that's regardless of whether you've hit full retirement age. So again, that important distinction between reduction of benefits and paying taxes. Government will always have you pay taxes.
Yeah, and actually one thing I'm going to plug here real quick. Let me see if I can get it here. Hang on just a sec. All right, let's see. Maybe not. Actually, yeah, for some reason I can't get it to come up. We have a tax guide. And on that tax guide, there's a whole section on Social Security. So if you'd like, in the chat function, if you would like to have that, just let us know your email address and we'll email that over, because it does have this information in here on taxation. And it also has the breakdown as far as years of reduction if you were to continue to work before you get to the full retirement age. Okay, I think that's it. Great job, Eli, and we'll turn the rest of the time over to Aaron to get updated on Medicare.
Awesome. Thanks, you guys. Let me all right. Can everybody see that?
Yes.
Is that screen showing yet? Yeah. Okay, good. So Medicare, Social Security, Parker, Eli, Ira, and I will chuckle at times. I don't know if some of you can relate. You end up doing something in life that's kind of where you get stuck, and to a certain degree, you kind of breathe your own exhaust. And certainly with Social Security and Medicare, we're used to all the lingo, all the acronyms, the yearly changes, because they both are government-sponsored, supported programs. It can be pretty overwhelming. And we highly encourage you, as Eli said there, you just need to view some of this. At least I'm wired that way, where I just need to see it in front of me. What if this? What if I wait 2 years for that? We made a bunch of money 2 years ago. How is this going to affect it? And all of us have calculators that will spit out those exact scenarios so that you can have data to make an informed decision. And certainly with Medicare, for those of you that are approaching 65 or are already past it, you are about to become one of the most highly marketed to individuals in the country. And our resource is here at no cost. We have even worked with people as young as 55 years old that they're just starting to plan ahead and say, hey, how does Medicare compare to my employer benefits today? I just kind of want to know what to look forward to. And we are happy to talk with you guys in advance of your Medicare age. And before I dive into this presentation, I kind of want to talk just as a normal person. What could you expect if you do call in? What type of questions are they going to go over? What does that experience look like? And I'm going to start by saying, so I have a thyroid issue. I have hypothyroidism. And if I were to call in, why that's important is there are, depending in where you live, down to your zip code, tens of plans available, 50 plus in some parts of the state. How do you know which plan makes the most sense? Well, one of our agents is going to be asking you, what are your prescriptions? So in my case, I'd be saying, well, I take 175 micrograms of levothyroxine once a day. And then I would go through every other prescription I might have. If it's metformin, if it's whatever it might be, they're going to go through all of those. And that takes the plans and narrows them down a bit further. Then we're going to ask, who are your doctors? Who do you want to make sure you continue to see? Then we're going to ask, what about facilities? Are there hospitals or facilities that you want to make sure are in network? And by going through all that, that large amount of plan selection is narrowed down to just a handful. And at that point, it's kind of more comparing what are the cool little benefits that might make sense for your situation. So that's what to expect. We, again, highly encourage you, if you have questions, want to plan ahead for Medicare, to give us a call. We do represent every single company in a given area. And that is by design, just to make sure that what we select and help you choose makes the most sense. So Medicare was signed into law back in 1965. If we were in person, we'd be playing a bit of a game here to see who remembers 65 the best. Any guesses of what the best-selling car was? Many people think it's a Mustang. It is, in fact, the Chevy Impala. Chevy sold 1,075,925 units of that vehicle. Highest rated TV show back in 65 was a Western. It was Bonanza. Andy Griffith's Bewitched, Beverly Hillbillies, Gomer Pyle were all popular, but Bonanza was the runaway hit. The Gemini program was in full swing back in NASA. I don't know if any of you have been to Cape Canaveral, but that rocket is laid on its side, and it is pretty awe-inspiring to see. And then this little-known band made its historic debut on the Ed Sullivan Show. And finally, for you history buffs, in this picture we have two U.S. presidents, Truman and Johnson. President Truman, right here, was the first recipient of Medicare. He was President Johnson's predecessor. He had hoped to sign Medicare into law, but wasn't able to do so. But he did have the honor of being the first recipient. Yes, that is his card and his Social Security number. The new cards look a lot different, obviously to protect your identity. Well, Medicare, who is eligible, and why do we present this in concert with Social Security? It's because a lot of the eligibility requirements are the same. Have you worked for 10 or more years, that's 40 quarters, paying into Social Security? And if it wasn't you, was it your spouse? Are you a citizen and a permanent legal resident? Now, some of you might be saying, well, hey, I've got a cousin or I've got a neighbor that they're not 65 and they're on Medicare. Well, that could be. For anybody that's been receiving disability, in your 25th month of disability, you become eligible for Medicare. Also, anybody with end-stage renal disease or Lou Gehrig's disease can qualify. And if you have questions about eligibility, you do need to call 1-800-MEDICARE and they can talk you through that. Now, as we talk about this, again, as Eli had presented, there's all sorts of acronyms, your PIA, your FRA, In Medicare, it's the same. We've got your IEP, OEP, AEP, SEP. Again, that's part of our benefit is to talk you through what they all mean. But for us, when we say EP, we're talking about enrollment periods. When can you and when should you enroll in Medicare to avoid lapses in coverage or any potential penalty? The most common for everybody is your IEP, your initial enrollment period. And this is a 7-month window. You have 3 months before, the month of your 65th birthday, and 3 months afterwards. If any of you are still working and you have employer-sponsored group benefits, leaving that coverage triggers an SEP, a special enrollment period, and you could basically do that at any given point. If some of you call us today and say, wow, this plan is the best thing I've ever seen, you could start your Medicare next month. And that, again, leaving your employer coverage triggers a special enrollment window. Well, why do we even need additional coverage other than original Medicare? I've heard that original Medicare is 80-20 coverage. That sounds pretty good. If I've got a $100 bill, I'm only on the hook for 20 bucks. I could do that. The problem with this is those co-pays, co-insurance, and 80-20 coverage has no limit. My wife was diagnosed with breast cancer 3 years ago. I don't necessarily say that for pity. She's totally fine. We caught it early. But I tell you what, had my wife and I been at retirement age on a fixed income, some of the medical bills we saw were astronomically high. And if we were on the hook for 20% of them, it would have been catastrophic and completely life-changing for us. So for that reason, in addition to the foundation of original Medicare, you can choose from 2 broad categories of plans that we're going to go into detail on: Medicare Advantage and Medicare Supplement plans. Again, we represent both categories of plans, and it really is just going to come down to what makes the most sense for you. So, original Medicare, you keep hearing me say that. That is Part A and Part B. A is hospital, B is medical. It's administered by the government. And again, we're going to call that original Medicare. You also have Part C, which are Medicare Advantage plans. And Part D, this one really makes the most sense to me, D for drugs. These types of plans are administered by private insurance companies. Like here locally, that would be Select Health. Well, University of Utah pulled out. They used to have a plan, but Cigna, Aetna, Humana, a lot of names that you guys have heard and probably seen advertised on TV represent plans in these categories. Medicare Advantage, I'm going to repeat this a lot. I want all of you to think this is just like the benefits I have today. One card, they're HMOs, PPOs, but again, we'll deep dive that coverage in a minute. Okay, so back to original Medicare. When I say that Part A is hospital, what I mean is that's inpatient. That's a stay in the hospital, skilled nursing, hospice, home health care. Part B is going to the doctor. So outpatient care, your labs and x-rays, any drugs that are administered in office, some DME and preventative, that would all fall under Part B. The cost of Medicare. Part A, for the vast majority, if not 100% of you, is not going to have a premium because you've worked and paid into the system for those 10 years. The actual cost of Part A is right here. So if you're hospitalized, you have a $1,600 deductible that you'd need to meet. And if you were hospitalized for long lengths of time, this is a daily copay. So again, you can start to see how there's a bit of risk that original Medicare leaves you open to that you need to prepare for. Part B, the vast majority of you will pay $174.70 for this year. I actually think that's supposed to drop a buck or two next year. For those of you that have planned well or have incomes that are going to be above $103,000 for an individual or $206,000 as a couple, this will rise, and it can rise drastically, and we'll review that in a moment. The actual cost of Part B, there is a $240 deductible every year, and then that 20% again with no out-of-pocket max. I'm not going to go through this line by line, but here's where you can see if you and your spouse or you as an individual make file taxes or earn money at these levels during retirement, your Part B premium will be rated accordingly. So in addition to the risk that we've discussed, Original Medicare also does not cover prescription drugs, routine eye, dental, hearing aids, custodial care, chiropractic care, care outside the United States. And again, as we've discussed, it is not all there is. You have two big categories of plans to choose from. The first category is called a Medicare supplement, also called a Medigap. This plan, the way that I like to remember it, is you use 3 cards for services. You still have your original Medicare card for Part A and Part B. Your supplement card directly covers those co-pays, co-insurance, and 20%. And then you need to add standalone prescription drug coverage, so you'd have a third card for that. The other broad category of plan is Medicare Advantage. Again, I hope some of you are thinking, oh, that's like the benefits I have today. One card and all the benefits are rolled into one. So let's deep dive those Medigap, the first category. When to enroll, you always have to have your Part A and Part B. These plans are guaranteed issue the first 6 months when your Part B goes effective, or within 6 months of your 65th birthday. We absolutely recommend, if you're going to go this route, that you do it when it first goes into effect, and that is because they're guaranteed issue. Okay, blah, blah, blah. What does that actually mean? If I do not enroll in a plan like this right off the bat, and 2 years down the road, I find out I have to have a major surgery, or let's even say I win the lottery and I can afford the higher premiums, and I'm like, you know what, I want to go the Medigap route. A guy like me with my thyroid, I can be underwritten. I will be underwritten. And there is a chance, now I wouldn't necessarily get denied coverage for my thyroid, but my premium could double. Somebody like my wife that has a history of cancer, she would be flat out denied coverage. So when one of our agents speaks with you, we're going to be asking, is there any major surgery that you know you're going to have in the first year? Do you need a hip, a knee, some type of major surgery that you just don't want to worry about bills? A Medigap may be something to consider. Again, please remember these plans do not include prescription drug coverage, so we would need to add that in addition. These plans, again, are sold by private companies. Something that we love is that there is not a network. If a doctor takes Original Medicare, they will take this plan. So maybe let me pause here for a minute again and just kind of talk to you as what do we see for people that call in? The vast majority go with Medicare Advantage, but those that choose a Medigap or supplement plan, again, it's those that know they have a surgery. It's those that are going to be traveling across the country, visiting kids and grandkids, and they don't want to have to worry about a network. Those are kind of the two circumstances when we see a lot of folks go this route. What we don't like is that these premiums every year go up. It's guaranteed. And I would say this is educational, so please don't hold me to this, but the premiums range anywhere from $50 to $150 your first year. And again, that goes up every single year. Ira and I have worked with hundreds of folks, and the few that go this route, they usually end up calling after 5 years saying, hey, this is getting too expensive. Let's take a look at the Medicare Advantage. This next slide is kind of a joke. It's for all of us to laugh at the government for a moment. These Medigap plans, as if we don't already have enough letters and acronyms, are assigned letters of the alphabet. They are standardized. Really, there are only 2 of them that are sold, and even this Plan F, unless you were 65 before 2020, you can't even get one anymore. A Plan G is the way to go. It is phenomenal coverage. The only part of Original Medicare it doesn't contribute to is the $240 deductible on Part B. But again, phenomenal coverage here. Just remember that we would need to add a standalone drug plan as well. Okay, Part C, Medicare Advantage Plan. This is the other broad category that you can all choose from. Again, your Part A, Part B, and prescription coverage is all rolled into one. In addition, these plans have vision, dental, hearing aid benefits, gym reimbursement and memberships, and a little bit of coverage when you travel. And here locally, some of the local carriers have killer over-the-counter benefits, Select Health being one of them. But again, that's kind of our job, is to help you compare all these various companies and see which might make the most sense. Additionally, I would tell you, there are not family plans in Medicare. You and your spouse will both be looked at as an individual. And it is not uncommon that one spouse is with one carrier and another spouse is with another company, because that's what saves them the most money and makes the most sense. Finally, a reminder, no matter which category of plan you choose, you will always pay that Part B premium of $174.70. These Medicare Advantage plans are offered at $0 per month in many parts of the state and across the country. Again, that isn't necessarily meaning that more money means it's better. It's just going to be kind of, what does the benefits look like? We're not going to deep dive all this, but again, here's just a comparison, some things to highlight on the supplement. We like that there's not a network. Any doctor that takes Medicare takes your plan. We're not a fan that the premiums raise as you get older. The 3 cards to use a plan like this may or may not bug you. And again, we want to be sure that we're taking into consideration the guaranteed issue component of these plans. Medicare Advantage, don't be intimidated by this saying that there is a network, a PPO and HMO. It's what you've had your entire working career. And again, those are part of the questions we ask you to make sure that there's not a big change. We like that there's one card, and we like that the premiums stay level on plans like this. I'm going to move quickly over the rest of this here, but if any of you go the Medigap, the supplement route, and you add a standalone drug plan, again, these are administered by private companies. They set the premium. You have the co-insurance and co-pays. And everybody, we use the government's tool. We literally plug your drugs right into CMS's website, and it tells us which plan is the most, would offer you the most cost savings. You want to enroll in these again when you first turn 65, or when you leave your employer coverage, to make sure that there's not a lapse in coverage, because there is a penalty with Part D, and it's permanent. For every month that you're not enrolled, you acquire, well, it's a government formula. Again, just know that there is a potential penalty. If you ever want to change your drug plan or any plan, you can do so every year from October 15th through December 7th. Again, for those of you that are still working, leaving your group benefits would trigger a window to enroll. We hope that you give us a call, but if you don't, if you have a cousin, family member, somebody that does Medicare, here are some things to ask them. Obviously, first of all, are your drugs covered? What tier do they fall into on the formulary? Is your pharmacy in network? Are there discounts by going mail order? Have you already been through the pain of prior auth, quantity limits, step therapy, and you don't want to go through it again? Be sure to bring that up. And if you are forced to transition, what is that going to look like? Similar to Part B, depending on your filing status and income, they do look back a couple years. Your Part D premium could be rated. The donut hole, if any of you have heard of that, is going to go away by next year. So we're not going to deep dive this, but again, know that the technology and the tool that we use tells us the exact month you would hit the donut hole, when you would leave it, and what your costs would be. And that is it. Hopefully I've explained it well. That number is right here local. You can reach out to Alan. He's an agent we have dedicated to Presidio and your group. And we're always here to answer questions.
Hey, thanks, Aaron. That was fantastic. And one thing I'll just comment on, these are great benefits, but as you can see from both Social Security and Medicare, the government doesn't organize these plans in a very efficient manner where it's easy for us all to understand. It's very, they make it very complicated. So definitely reach out to Alan if you need any help there. Reach out to us if you'd like your own Social Security estimate ran for you. We've got great software for that. We just had one question for Aaron. And so Aaron, if for example, if there is client who's going to be retiring, say, next April, and open enrollment starts October 15th, and they're still working until April, what is the best practice? Do they can they actually apply for that when that next April, or do they have to do something through that enrollment period through December?
Yeah, great question, Parker. For whoever that is, you don't need to stress. Again, if you're turning 65 in April, you've got 3 months before the month of April and 3 months afterwards to make a decision. But if you're still working, things that Ira and I would highly encourage you to consider is, are you contributing to an HSA? My wife is 4 years younger, so do you want to work a little longer because your spouse is younger? Because there are some rules and regulations and taxable events that happen related to HSAs and Medicare. So again, those would all be things that we'd want to talk through with you. But yes, you don't need to stress this open enrollment season. You can wait until the spring.
Okay, good. Let me just check and see.
There was, I think, one more question they're asking about the windfall provision. So I'll cover that real briefly. So the windfall elimination provision, really this really only applies to you if one of three things are true. And what this provision, to kind of back up, so if you don't know, the windfall elimination provision is basically a potential reduction in Social Security benefits if these three things apply to you. So if you worked for an employer for 10 years that did not pay into Social Security, wasn't paying the FICA tax. Number two, you're also receiving and eligible to receive a pension from them. And number three, you've worked at another job. So, because if you didn't work at any other job, you wouldn't have any Social Security benefits anyway. So if you also then worked at another job, received those benefits, the 10 years worth to qualify for Social Security, got those credits, and you had that PIA, you could potentially receive that reduction of benefit. And again, you can reach out. They don't really show it. If you go into the Social Security system, SSA.gov, and run it, they're not going to take that into account. They'll do that as of, but you can request a consultation beforehand. So you can get that information and get the details to take that into consideration. And it will lower that PIA number that we talked about. And then the same rules would apply, the reduction if you take it early or the increase if you take it late.
Right. Thanks, Eli. Well, again, everyone, thanks for your time. And thanks, Eli and Aaron, for presenting this today. If we are recording this, so if you missed something, first of all, give us a call or give Aaron's group a call if you have any questions on this. But we have a recording if you know anyone that would have liked to attend that didn't, that'll be available here shortly. And again, thanks for your trust in our firm. And we're very grateful for the trust you have in us, and grateful to you all for attending today. And hope you have a great rest of the day. Thanks.
Thanks, everyone.